Hi everyone, I'm Chelsea Grant. I'm here today with Julia Johansson. She is the manager of an accountable care unit here in Regina. So I'll hand it over to Julia and let her introduce herself and tell us a bit about herself.
Okay, hi, I'm Julia Johansson. I am the temporary manager of 3B at the Pasco Hospital in Regina. I have been just in the manager role a short 6 months, and when I say short, it's short. I have another 6 months in here, and then I'll have to decide if I want to do this permanent or not, or go back into my in-scope role as a nurse with Bedline right now. I have a long career in nursing. I've been in it 26 years, I think, something like that, really long. I actually started it in the health district in housekeeping, then I was a unit clerk, and then a bedside nurse, and then I went to Bedline, and here I am. So I've been in various different roles.
Awesome. How would you describe yourself as a leader?
Well, first and foremost, I always say that I'm a nurse. That is where my true heart belongs. But I do feel that as a leader, that's tough actually. I'm learning. There's lots of lessons to be learned. What I thought I would be as a leader has evolved already in 6 months, but I feel that I have open, honest communication. I tell my staff what I can. I have an open door policy. If they feel that they can approach me, they can approach either the educators or the resource nurse, or even leave anonymous notes if they really need to. I don't like anonymous, but we can. Just so that we have that open communication and it's always revolving. I'm open to constructive feedback or any ideas. And then I hope they're receptive of the same.
Cool. Did you always envision yourself in a leadership role?
I think eventually I thought I would be in a leadership role. I hadn't planned on going into it this early in my career, just the opportunity presented itself, and it felt like a no-brainer, being that it was only temporary, that I could go and try it, and if I didn't like it, I could then revert back. So it gave me that safety blanket. So eventually I thought I would get there. I'm just here a little bit earlier than I thought.
In your position as a manager, how do you think you influence the climate for your nurses on the floor?
Definitely, I believe I influence the climate, and I can even attest to that. Like if I'm in a mood and like it's so busy and we're not getting things, then all of the staff get into a mood. So it takes me a lot to get fired up, and the staff have learned that I'm pretty calm and cool and collected usually, unless I need to, but it's just, that's the way I lead, because then it also portrays onto our patients. So if I lead with frustration and craziness, that goes into the staff, then results into frustrated, crazy patients. I don't know if I should say that. Edit.
What has been your biggest challenge in a leadership role so far?
Oh gosh, there's many things. I would say the biggest challenge is not taking everything personal. I feel like everything is like a personal reflection of how I lead. So if a staff member isn't doing something that they're expected to do, I believe that then it falls on me because I've not given them that leadership, when in reality they have the same initials behind their name that I have actually. So that is a hard one. Or if we get complaints, because I have high expectations, not beyond anything that they're hired to do, but just I always want to give that great care. So that, and then secondly would be taking my work home. We are provided work phones when you are in a management role, and I have a very difficult time of just turning it off and being present with my family. So it's a lesson for me to learn yet.
Your unit is an accountable care unit. Can you describe what accountable care means for patients and healthcare workers?
Okay, so yeah, we're an accountable care unit. Honestly, it just means that our interdisciplinary team is all right here, ready and accessible for our patients and our staff. So we have 2 physicians here that split our 28 patients pretty evenly. They are here, they're supposed to be here between the hours of 8 to 5. Some are earlier, some are later. They're always available by phone outside those hours. We have pharmacy that are here all the time. We have PT, OT that are around. Our social workers, we have 2 of them. I just think because our interdisciplinary team is so large and we're all here, it gives better outcomes for our patients.
Okay. Can you share the mission statement for the Saskatchewan Health Authority and explain how you as a leader work towards that mission statement?
So the mission, yeah, I don't have this off by heart.
I don't expect it memorized.
It's We Care, we work together to improve health and well-being every day for everyone. And that is exactly it. I agree that we all work together. Like I said, we have a big interdisciplinary team. It's not just those that I spoke of, but it's like myself, the staff, the care aides, the housekeeping, dietary, all of them. And that is what we do, is we work together to strive for excellence. So what we said, something.
What would your advice be for a nurse who's wanting to head into a leadership role?
Well, first, I guess you have to think about the big picture, like where do you foresee yourself and what you're planning on doing. There's many lessons. You can't just go in and think I'm going to know it all, because that definitely, even with my years of experience, I have learned so much in 6 months. I do think that people that want to go into management, it's good to have different areas under your belt. Like, I had only worked one unit for a very long time before I had moved on. I do believe that you should have a couple different areas so you have that idea. I always was a surgical nurse, and then now this is a medicine unit, so I've learned a lot of lessons in it. You need to be open and willing to receive constructive feedback, because your other colleagues will come to you and say, hey, you did that, it was a goodish idea, but maybe you could have done it differently this way. So lots of lessons to be learned. I'm just open. I'm just trying to be in the moment, I guess.
Awesome. Well, thank you for your time, and thank you for sharing your experiences with us.
Thanks for choosing me.